Welcome, future patient. I'm Dr. Steve Goldstein from the Houston Healthcare Initiative. This is the first in a series of short videos. We will help educate patients on how to navigate our current healthcare system. This first video is entitled, How and Why to Shop for Medical Care. Now, in today's environment, if you don't have government insurance, such as Medicare or Medicaid, you probably have a high deductible policy. And if you don't have insurance, you're obviously having to pay cash for your routine medical care. And you have to pay cash if you have a high deductible policy as well. Let's explode the myth that you can't get health care without health insurance. If you're paying cash, you're freed from the insurance company regulations, and you don't have to be, quote, in network, end of quote, or you don't have to go through all the bureaucratic maze of getting your test approved and having delay in getting your test done because of it. Now, in order to help you shop, you can visit our website, HoustonHealthcareInitiative.org, where we have published many cash prices. If you shop yourself and come across a good price, please let us know and we can publish it on our website. Now, this is something that needs to be done in advance. You can't do it when you get sick. What are you going to do if you get sick? Have a plan of action. Is your primary care doctor available to you quickly by phone? How quickly is he available with a telemedicine visit or with a in-office visit? Can you also use a walk-in clinic? Can you also use an app on your phone and get a telemedicine visit with a physician in a few minutes? Check out the various choices in your area to see what is best for you. Now, we do know that you want to avoid the doctor's office that has a message on there. If you have an emergency, go to the emergency room. I don't understand how a doctor expects a patient to know whether or not they have a true medical emergency or not. Let me give a few examples to explain what I'm talking about. Let's say you fell and you injured your wrist, it's swollen and tender, and you think you may have broken your wrist. Before watching this video, you might think you need to immediately go to the emergency room or to an urgent care. Well, I would only go to an emergency room if advised to by a physician. You can call your family doctor if he's available, or you can get an app on the phone and get an instant telemedicine visit. Here are the facts of the situation. If you don't have a bone sticking out through the skin, and you have normal feeling in your hand, and you can move all your fingers, you do not have a medical emergency. The treatment for this condition would be to splint your wrist, put ice on it to get the swelling down, and take pain medicine to keep you comfortable. Now, it's true you do need an x-ray to figure out whether or not you broke your wrist or not, but this is, again, not an emergency. It can be done in a day or two. If you have a broken wrist, the orthopedist will not cast it for a few days until the swelling goes down. And if you got the x-ray at a freestanding clinic, it is certainly a lot cheaper than getting it done in the emergency room or urgent care, to the tune of maybe 5 or 10 times cheaper. You can also compare the cost of the telemedicine visit with the cost of the emergency room doctor. In addition, if you go to the emergency room, there's all sorts of extra charges the emergency room tacks on there just for you walking in the door. So it's significantly cheaper to be prepared and have medical advice available to you before going to the emergency room. Let me give another example. Let's say you have noticed that you have frequency in burning on urination. You may or may not know that these are symptoms of a urinary tract infection. You can see your doctor. He can maybe do a urine analysis or a culture, prescribe antibiotics, whatever is appropriate. You can do that with a telemedicine visit. You can do that through an in-office visit. You can go to a walk-in clinic. You can use the app on the phone. It's your choice, whatever you feel is best for you. Now, whatever you do, get a prescription for the lab work and a prescription for the antibiotics. Don't do the test at the hospital or in the doctor's office. That's the most expensive place to get it done. You can go to a freestanding laboratory and get those tests done just as well, or you can, same thing with x-rays, much cheaper. How to do that? You can go to our website, HoustonHealthcareInitiative.org, where we have links to laboratories and imaging centers that have reasonable prices for these tests. Now, I hope you learned from this and got a different perspective on why and how you should pay cash for your medical care. Please stay tuned, because we have further videos that will help you navigate through our current healthcare system. In the meantime, stay well and live well. Thank you.